It's me, that middle-aged lady. Before I get started on the video, I just wanted to apologize if you can hear any traffic in the background. I live in the country, but on a busy main road, unfortunately, where when people are going by doing 55, 60 miles an hour, it can get quite loud, especially if it's like a diesel truck or a semi truck. Doesn't matter what room in my house I go into, there's windows in every single room. And the only way that I can do a video and have at least a little bit of peace and quiet is if it's probably 1 or 2 o'clock in the morning. That's the only time I think I can actually have a little bit of peace and quiet in my household. And so I just wanted to apologize because, again, I can hear, even doing this right now, that there's definitely traffic going through. So hopefully that doesn't come through in the video, but if it does, I just wanted to apologize. I would like to welcome you to my channel, That Middle-Aged Lady. For those of you who are familiar with me or follow my channel, as you know, I was diagnosed with vaginal atrophy in April of this year, so April of 2023. For those of you who are not familiar with me, I do have several videos uploaded on this particular topic of my journey from being diagnosed with vaginal atrophy, what my course of treatment was, and where exactly I'm at in that process today. If that sounds like something you might be interested in, I hope you'll check some of those videos out. But the reason that I wanted to do today's video is because the journey of being diagnosed with vaginal atrophy and everything that's happened in the course along the way has definitely been filled with some ups and downs, a lot of concerns and worries, lots of questions for my doctor, and then hours upon hours of research as well. And now I recently had another symptom pop up that, to be honest, I'm not even 100% sure if it's even related to the vaginal atrophy or not. But I definitely wanted to do a video about it just to put it out there and let other women know exactly what's going on in my journey thus far, and to also see if anybody else has perhaps experienced the same thing as well. Just to backtrack a little bit to kind of explain how I got to the point of where I'm at today with this. So back about a year ago, before I was ever diagnosed with a vaginal atrophy, is when I first started to experience the symptoms. In my case, it was severe burning in my vagina that was pretty much all day and night. I also was having some of the urinary symptoms, being burning when I would urinate. I also had a couple different UTIs as well, and then I would have some urinary frequency and urgency as well. And so because I didn't want to accidentally leak a little bit of urine in my underwear, I decided to go out and get some panty liners and wear a panty liner every day. So that way, just in case I couldn't get to a bathroom in time, the panty liner would absorb the urine. So hopefully I wouldn't have to go around smelling like pee. And so that worked out great until about maybe a week or two after I started using them. I would notice from time to time that I would see this little bit of brown on the panty liner. So of course my first thought was that I just must not have been wiping good enough after I had a bowel movement. So I told myself clearly I needed to be doing a better job. But again, it would continue to happen from time to time. And again, never really concerned me enough to think anything was wrong or that I needed to say something to my doctor about it. In the meantime, I was diagnosed with vaginal atrophy and was prescribed the Vagifem for my symptoms. And after about 6 weeks, all of my symptoms subsided and I was no longer feeling that burning in my vagina or having the urinary symptoms. And so at that time, I decided to go ahead and stop using the panty liners. And I never noticed, any kind of brown spots in my underwear or anything else that would have been any cause for concern. And then after I'd been on Vagifem for a while, I decided that I was going to try and see if I could go down to using it once a week opposed to twice a week as it's directed to be used. And I had a couple different reasons for that. The first reason was because I had inadvertently been forgetting to take it one of the 2 times a week. My regimen was a Wednesday night and a Sunday night, and inadvertently, one of those nights, I would end up forgetting to insert it or to use it. I can say that, I'd imagine a lot of people are like this. Say you're prescribed antibiotics for an ear infection or something along those lines, and your doctor tells you now you want to make sure and take the full 7 to 10 day course of it. But then in my case, after a couple of days, I'm feeling better. I kind of throw them in my nightstand, don't think about it anymore, and I no longer am taking the antibiotics. And the Vagifem was kind of the same thing. As soon as I started to feel better, it was kind of like an out of sight, out of mind kind of thing. And so I think that's why it wasn't in the forefront of my mind to make sure and take it like I was when I very first was diagnosed with this condition. And so I was afraid that I was going to end up, somehow screwing up my body or my system By 1 week, I only use it once. The following week, I use it twice, and then once, and then twice. So that was the first reason why I decided it was time to maybe go down to using it once a week, which was easier for me to remember opposed to doing it the twice a week. The other reason was because my gynecologist had talked to me about it when he put me on it and said that, and this is something that I've also read a lot about as well, and that is the least amount of estrogen that we're putting into our bodies for the least amount of time is always best. Now, I'm aware that Vagifem, obviously it's localized to the vagina, and so supposedly very little of it actually gets absorbed into the bloodstream, but we're still putting extra estrogen into our body. And so he told me, after I had my pelvic exam done and another pap smear repeated and everything came back good, and he said my vagina looks so much healthier. He said, it's up to you now if you want to try and go down to using it once a week. And I did do a video about that recently as well. So if that sounds like something you'd be interested in hearing more about. But again, so I've been down to once a week for about 2, maybe going on 3 months now. At first, everything was great. I didn't notice any type of changes in my body until about 3 weeks ago. I started to notice that these weird symptoms that I had just before I was diagnosed with the vaginal atrophy, being my chin was breaking out, I was getting like these canker sores in my mouth. They were starting to come back again. And then I also noticed that both of my breasts started to get tender again, which is one of the symptoms that I had right after I started Vagifem. And then also whenever I would shower or comb my hair, I was starting to lose some hair, which hasn't happened to me since back when I was having my periods. And so getting a little concerned that maybe I wasn't putting enough estrogen into my body by only using it once a week, I decided that because I was about to go in to have my physical, which is going to be a week from now, so a week from today is when I go back in to have that physical done, I was going to have my estrogen tested again. And depending on where my estrogen level was at, was going to, be the deciding factor for me whether I was going to go ahead and start using the Vagifem twice a week again, or just go ahead and stick with it once a week and see where that was going to take me. And then after I started to experience some of these symptoms that I had been experiencing before, I decided to go ahead and start using panty liners again, just in case any of the urinary symptoms came back, because again, the last thing I want to do is go around walking around smelling like urine. And so that is when about, 3-4 days ago, that I noticed that not only will I see a little bit of brown discharge from time to time, but again, about 3-4 days ago, I noticed that this time I was starting to notice what appeared to be black discharge as well. And I wouldn't say it was like a ton of it, but definitely enough of it on the pad that when I happened to look down, I was quite shocked to see it. Being completely freaked out as to why I would have this black discharge on my panty liner, first thing I did was went to my computer to see if I could find out any information about it, since the first place your mind is automatically going to go to is, could this be cancer, either uterine, ovarian, or cervical? And so from what I could gather, it sounds like 90% of women that have one of those cancers, one of their first symptoms is vaginal bleeding. However, it says that it is more of like a red color or even a pinkish color rather than a brown, and I didn't see anything about it being black. I do know that a darker blood is usually indicative of old blood, like towards the end of your period when it takes that blood a little bit longer to flow out of the vagina. Sometimes that can be a little bit darker. And then from what I was able to find, it sounds like when that old blood then hits the oxygen, it oxidizes it, and that's what causes the color. The next thing I did was to call my gynecologist office to get an appointment. Unfortunately, they can't get me in until the first week in December. I feel like it's a hurry up and wait kind of situation. And so I ended up going back online again to see if I could find out any more information. And the more I looked into it, apparently vaginal atrophy can absolutely cause this either brown or even a darker blackish color discharge. And I guess the reason for that is because of the inflammation and the irritation on the cervical lining can cause it to then sometimes bleed, and even using Vagifem sometimes can cause a little bit of vaginal bleeding. And depending on how long it takes for that blood to then flow out of the vagina, that could be what's causing that darker color. The other thing that kind of plays into this is that I have had 3 different pelvic exams done in the past 7 months. The first would be when I had my first pap smear done just before being diagnosed with the vaginal atrophy. Then I had another pelvic exam done, a more thorough pelvic exam done when I went back in because I was having symptoms of the vaginal atrophy. And then 3 months after that, I had to go back in and have my pap repeated. And he did another thorough pelvic exam to see whether or not the VAGFM seemed to be working. And so I feel like if something were going on, he would have been able to notice something, up in there, especially because the last two pelvic exams were a little bit more of a thorough exam. So that's kind of got me wondering what's up with that. I've also had a pap smear done annually every year. I know it's only recommended for postmenopausal women 3 to 5 years, but I've always felt it was important to go on once a year. Mine did come back abnormal just before being diagnosed with vaginal atrophy, but then after I was put on VAGFM for 3 months and I went back in, that one came back normal. Now I do know that it only, the screening for a pap smear only screens for cervical cancer, but sometimes it can pick up changes if you have uterine cancer as well, and mine came back completely normal. And then the other thing that kind of leads me to wonder if it would have anything to do with, having any type of cancer is that back about 2 years ago, I had some issues with having some kidney stones that I had to end up having several different ultrasounds and also having a transvaginal ultrasound as well, which I was told that I had a very small fibroid tumor. And so I did go in to see my gynecologist after that just to have it confirmed, and everything turned out okay with that. He saw absolutely no issues with it whatsoever. But again, a vaginal ultrasound definitely should have picked up any type of issues going on. This also kind of leaves me to wonder if maybe this isn't due to blood in my urine rather than blood coming out from the vagina like old blood, considering I do have a history with kidney stones. I've also had to have surgery about 2.5 years ago to fix a kinked ureter that went from my kidney to my bladder. And I also had to have a stent put in there for about 6 months. And so I definitely have an issue with, the kidney, the ureter, and then the bladder, and then the kidney stones. And so it could just be that, maybe I've had a kidney stone that's been trying to work its way through. It seems that I've had blood in my urine microscopically. I've never noticed a visible type of blood in my urine, but I've had microscopic blood in my urine for several years now. Every time I've gone in for my physical, I've been told I have a little bit of blood in my urine. And so it could be related to that as well. And so at this point, I think the best thing to do is to start with a gynecologist, especially since I have been diagnosed with the vaginal atrophy and I am on medicine for it. So I want to start there, let him do another pelvic exam, figure out maybe he wants to do another ultrasound. I don't know exactly what all he's going to want to do. And then, go from there. If that isn't the problem, then, I might try and see if I can figure out if it isn't coming from my bladder or because of the fact that I do have kidney stones. Maybe it's nicked that ureter as it's going down and there's a little bit of blood up in there that's taking its way to come through. And so I just wanted to put that out there for everybody to let everybody know where I'm at with this. And I would love to hear from anybody else who has also experienced this type of thing. Sounds like it's pretty uncommon. And of course, if it's going to happen to somebody, it's going to happen to me. If there's one thing I've learned in my life, it's that I'm that person where all these weird and strange things seem to happen to. And so obviously my biggest concern is that it's not cancer. If it is, then certainly I would hope that they caught it in time to be able to do something about it. But all I can do is wait until December, the beginning of December, to go in and see the gynecologist and, see what he has to say. Obviously, as always, I will keep everybody updated, and then after I go in for my physical and I have my estrogen tested, I plan on doing another video about that as well, just to let everybody know where it's at now that I've been on the VAGFM for about 7 months now. And so that is all I wanted to share with everybody today. I thank you so much for joining me, and again, if you have any comments, I would love to hear about them. And other than that, I will be back with the results of my estrogen level, and then once I get in to see my gynecologist to see what in the world is going on now. All right, thank you so much, and I hope to see you guys again next time.